based in Budapest. And I'm managing a regional project called Bridge, which stands for Building Relationships Through Innovative Development of Gender-Based Violence Awareness in Europe. A very long title for this project. But we are implementing it from this office as the lead in a partnership with a number of NGOs across Europe, namely Defense for Children International in Belgium, and FedAsyl, which is the federal agency for the reception of asylum seekers in Belgium, as well as NGO Arsis in Greece, an NGO called COPIN in Malta, and the Terre des Hommes office in Romania. This project is supported by the European Union's Rights, Equality and Citizenship Program 2014-2020. And in a nutshell, what we're aiming to do with this project is to really contribute to strengthening the capacities of the statutory response to gender-based violence, which is affecting children and youth on the move, so migrant children. As part of this project, in addition to capacity building, training materials or curricula that we have developed, as well as an e-learning course on gender-based violence, which I encourage you all to check out and hopefully to enroll as well. These are available on the Child Hub platform. The e-learning course is available on the Child Hub Academy as well, which you can find the link to the Child Hub platform. But in addition to this part of the capacity building component, we are also organizing a series of webinars to exchange, to discuss various aspects and issues related to gender-based violence in the context of migration, and to share good practices, information on interesting initiatives, and to share knowledge and learning. And as Vesna said, in this webinar, we have the pleasure today to have Mr. Govinder Singh, who will be presenting an interesting study that has been developed by the IFRC, the International Federation of Red Cross, which is called Alone and Unsafe. And with the study, the study has sought to improve knowledge and understanding of the risks and the different types of sexual and gender-based violence that is affecting children who migrate on their own, so alone, and also looking at the widespread gaps or that exist in the protection that is available or is being provided to this category of children. So this is quite linked with what we have been looking at within our own project, the Bridge project, and which is something that we keep finding also with our interviews and questionnaires that we have been conducting as part of a mobile data collection activity. So in fact that there are widespread gaps existing in the types of assistance and protection that is being provided to children. Gurvinder works as a senior child protection advisor at the International Federation of Red Cross, and he's responsible for development of the IFRC's guidelines, advocacy initiatives, as well as tools for implementing quality child protection programming. And he has worked with the Red Cross and Red Crescent movement for 20 years in the different capacities, as a local responder, as a national coordinator, as well as an international delegate, and for the IFRC as a global advisor. So we're very happy to have you, Gurvinder, with us today. And I would like to thank you very much for being available and for collaborating with us. And I would like to wish you all an enjoyable webinar. Thank you.
Thank you, Ninad, and thank you, Vesna. Thank you to TDH for this wonderful invitation to talk to all of you today about some work that I think that we have a very common interest and passion about, protecting kids that are on the move. I know that TDH, you do incredible work around the world with migrant kids in particular, and it's something I feel we're probably not doing enough together as IFRC and TDH is finding ways to link up. So this is a really fine opportunity to to have some interaction and conversation, and hopefully we can do more in the future. So thank you very much, and thanks everyone for taking some time out of your busy days for this session. Please jump in if you have questions, comments, ideas. I will go through the session, and then perhaps we can have a dialogue because I'm really interested in hearing about learning from your work. The Bridge project sounds incredibly important, and fills a need that I think we're finding is just so important. This type of project like Bridge, they're just not out there with this inclusion of SGBV components. So it's a really great project you have, and it'd be great to have that dialogue. The global study that the Federation worked on is called Alone and Unsafe, and I mean, it's really a sad title in many ways. It just shows that so many children are out there traveling, moving, mobile alone, and how unsafe they are, and how we're really failing them as humanitarian agencies and as governments as well. In terms of the background of this work, there was a UNICEF study about 2 years ago that many of you might be familiar with, that showed 300,000 children are migrating alone around the world. That was 5 times more than 2012. Of course, the numbers have shifted again since 2017 now, 3 years later. And even at the time, we know the numbers really varied by region. So we look at, there was a great surge in numbers of children traveling alone to Europe and within Africa at the time. We know that that shifted again, where Asia, the numbers have thankfully come down, but at the same time, new barriers being put up for children. Places like the Americas now seeing larger numbers with the crisis in Venezuela, for one example. We also saw in the background, in terms of why we did the report, was that in our work, we were consistently seeing in assessments, in studies from ourselves and from other agencies, that this risk of SGBV against unaccompanied separated children was being raised, but the evidence really was not being cited, so it was not something with a clear citation saying, here's more evidence, here's more data, here's more reasons or cause for children that are traveling alone being at risk of SGBV. It was just kind of an assumption, or let's say a field-based understanding that we had, but not something with strong evidence. So this study was trying to put in an effort to compile data from different sources. So we did an extensive literature review, looking at studies from different parts of the world, and found that there was pockets of available evidence, but these were not very expansive and weren't being pulled together in one place. The other reason for the background, in terms of why we did the report, was that our own Red Cross and Red Crescent societies work with unaccompanied and separated children around the world, probably in a lot of the same places as TDH. And they wanted better guidance because they were coming across kids who they felt were at risk of SGBV or who had experienced it and were uncertain of how to move forward, especially in what we call last mile locations, but let's say hard to access places, sometimes where very few humanitarian agencies are present because of political, geographical, or other barriers that put populations in a very hard to reach location. The methodology for the report was an extensive literature review, looking at academic, humanitarian, so white and gray literature in different places. We interviewed a number of specialists from humanitarian agencies working on these issues. And I just looked at this yesterday, and it's really interesting to me. So TDH, I think we had tried to make a connection, and then it never worked out, but you weren't on this list, and it's a shame, because I think the experience, again, you bring with your work on the field would be really valuable. And again, like the Bridge Project, you're doing such incredible work. We did in-depth case studies and research missions to Afghanistan, Honduras, Niger, and Turkey, each of which was looking at unaccompanied separated children in different ways. And then there were some other projects where we had detailed programming that we also drew from. The key findings, and I think many of these will not be a surprise to those of you who are working on these issues on a regular basis, is one that we have as humanitarian agencies and governments blind spot around protecting unaccompanied separated children from SGBV, and in particular boys, which I'll come back to in a moment, but there was some real gaps there. Also that we often see unaccompanied separated children within our own geographic space. So I work in community A or country A, but what happens to the children when they move to the next location? Often those links are very weak, and I think we all recognize we need to really strengthen across countries and communities how we support kids when they're on the migratory route. And also that our systems are really failing children when it comes to identifying, screening, and referring unaccompanied separated children for SGBV. Just to come back to the first point, when it comes to boys and girls, we saw a real difference. Of course, I think we can all acknowledge that girls are at high risk of SGBV and that it happens to boys too. When it comes to the situation of unaccompanied and separated children, we know that the percentage in most regions, not all, but most regions, it's much higher for boys. And so we see, in some places, 90% of the unaccompanied or separated children that are moving are boys. And a much lower population is girls. That's, of course, for reasons such as restrictions on girls' movement in some communities or cultures, not wanting to send girls out alone, greater fears around girls' safety, etc. Girls not seen as breadwinners, and so families not encouraging them to leave and try to earn an income in a different country. As we know, in some locations, families invest in sending children out alone so they can become more economically wealthy and send money back to the families. So we have, with unaccompanied separated children, many more boys who are traveling alone. Then we have girls, and as a result, we see boys having a much higher risk of SGBV than maybe they would in normal circumstances. Everything from having to barter to move on to other locations, same as with girls, all kinds of situations putting boys at higher risk, but that's often a blind spot for us. Also, that when we look at frontline health workers and psychosocial personnel, especially when we move out of urban locations into more rural, hard to access locations, we found that the capacity was very low generally in terms of responding to SGBV. And then when you add in how to work with migrant or unaccompanied children, the skills, the understanding, the training that was being provided was incredibly low. And so we have kids who are trying to perhaps access services, but they're with personnel who have not been trained on these issues in terms of how do I identify for SGBV, how do we refer, how do we make sure that we take a survivor-centered approach. All of these things generally were very much lacking. And then making it more complicated, you have children who might not want to access health services, might not want to share that they've experienced SGBV for fear of retaliation or being caught up in the government systems and having to be returned or being sent somewhere they don't want to, all of those typical barriers. Another finding was that we generally are not, as humanitarian agencies, conducting in-depth gender and diversity analysis on our work with unaccompanied separated children. So often we're seeing assessments and reports that talk about boys and girls in a very neutral way, not really explaining the particular needs or gaps for girls, for boys, for other populations. Another group that's really a particular risk and is not given much visibility is adolescents, older children who might identify as lesbian, gay, bisexual, transgender. And the limited data that was available was very informal about this population of children. And it found that in some circumstances, like in the United States, transgender adolescents were at a very high risk of SGBV in different forms. Again, just from one location and anecdotal, but that's an area that needs more attention. And again, it's an area we can probably strengthen our work. Some more key findings were that children often, to get the services they need for SGBV, are being referred from one location to another location, especially in urban centers. And so there's a need, really, ideally, for humanitarian service points where children and even adults and other populations can access humanitarian assistance in one place. And this place is accessible. The barriers around children, especially fearing to access it, need to be disabled. A big part of this is firewalling from immigration services so that children know when they access a service point that they're not going to be asked about their migration status. They're going to be able to have access to the services they need and for free. They're not at risk of being caught up in the immigration services system, being sent back somewhere that they don't want to go or don't feel safe, being put into detention. The detention issue is a very large concern, and I'm sure things are shifting in many countries slowly, but we've seen also in parts of Europe, in some of the countries you're working, where the first point of entry for unaccompanied children is into more or less a detention facility for several weeks, where they're screened and go through a process before they're possibly released. And so that is definitely not the way we want to be treating children, is through detention approaches. Not safe. And we also see children in some of these situations being put in the same facilities with adults with very little protection systems in place to keep kids safe and away from the adults, including in the evening where they might be placed in large halls or large rooms with adults, also just bathing facilities, all the rest of it. And so a need for humanitarian service points where children can access these services in a safer way. The government's, again, this idea of immigration and detention was a key finding that came up regularly around the world, including in Europe, where you're located, as a strong concern and risk to SGBV. There was also issues around how we tend to be very responsive when it comes to unaccompanied separated children. They're coming, and so we provide them services. What we haven't been strong enough at is forecasting and having an early response in terms of identifying what children are at risk in different communities or countries of becoming unaccompanied. We know that this can be driven, if families, because of poverty or status or trying to, or lack of opportunities, more likely are saving their money to invest in having children go out and look for money. How do we work with livelihoods projects, access to education, all of those safety things, especially in conflict and disaster settings? How do we support families? How do we forecast children at risk? And then provide services so the risk of them as they move is reduced. And then also scaling up projects that we know are showing results. So there was, when we look at SGBV and children migrating, it tends to be one part of a project. So we know we develop proposals, for example, we're going to work with migrant children, and there's a menu of maybe 10 things that we're going to look at, and SGBV might be one of those. And in reality, what that often means is that it gets pushed into the sides as, a checklist approach. We trained X number of staff. We ensured that there was some kind of a referral service. But in terms of really meaningfully understanding, building the capacity at the local level, making sure children can access the services, all of that can fall through the cracks. I think probably less for an agency like yours, which is really dedicated purely to working with children in these kind of situations. But I know for us and our Red Cross and Red Crescent National Societies, where this theme might be one of many, or other agencies, especially smaller agencies, which have a lot, or governments which are trying to manage the flux of thousands, sometimes, or dozens of children at one time. It can be really difficult. We also know that many of the projects that are actually targeting migrant children, including for SGBV, are very poorly evaluated. We don't have much investment on evaluations to show us what's working best and what's not working with kids that are on the move alone. So it makes our own work in the long term much more difficult. The barriers there are, finding the money from donors to do this, tracing children as they move across different locations is very difficult to evaluate and understand. And then also just the quality of evaluations where they do exist, they tend to be, not only are they qualitative, which in many ways is fine, but the quality of those qualitative evaluations tends to be not as strong as we would want. And they tend to be very, very small scale. And so we don't always understand if our interventions are working as well as we would want them to be, and if there's something that we can replicate into other locations in the future as well. And this also raises one more issue, again, mentioned earlier, is working across borders. As children move, it doesn't seem that in many locations, I think Europe's a little bit different because of the different systems in place across countries, it might be stronger, but generally, are we working across borders to protect children the best that we can? Probably needs improvement. And then also working across humanitarian agencies. There are not many platforms where there are systems where agencies come together for meetings, once a month, or in some places more frequently, which is really fantastic to exchange information. And then at the same time, we heard from many humanitarian agencies saying there's a sense that we don't coordinate our actual response well enough. So we might use different tools, have different principles in place in terms of working with survivors or children at risk of SGBV. We might take different approaches. We don't always coordinate the services that are available. So we might have in an urban setting several that could be strengthened if we coordinated better in terms of sharing information, joining forces where it makes sense, all of those things. So sometimes there's barriers even in terms of humanitarian agencies working together. And finally, we know that the situations these kids are moving through often are very volatile, they're unstable, they're unpredictable, which just adds to their risk. I'm thinking of a place like Niger, where we had so many kids coming from Nigeria up through Niger into Africa, trying to get across the Mediterranean into Europe. And what we saw was on the route, girls not being able to pay for certain portions of the journey, and so being put into brothels, being put into sex work, and then being forced to generate the revenue to move on to the next stage. In those situations, the role of the Red Cross was to was the only agency at the time given access to those sex work, to the brothels, to provide health services, psychosocial services to those girls. But we need to see more access, really advocate for that better for kids who are in situations that are particularly vulnerable, particularly isolated, and we're probably much stronger doing that together as humanitarian agencies rather than alone. And just to say, I think we can all clearly agree that what happens to kids today is going to really shape the future. In places like Europe, where we've seen a decline in the number of unaccompanied separated children. However, now we know those kids are turning into adults that arrived in 2017 and are still in the country. How do we support them over the medium and long term into productive work, into education? Those type of challenges remain, so they're not socially isolated, to really help integrate these kids in a productive way. Red Cross and Red Crescent societies in Europe are doing some of this work, but there's only pieces of it that's being done. And we know that, again, you're doing such significant work. Other agencies are doing it. How do we work together to support these kids to reach the best outcome? I'll stop the presentation there, and maybe we can just do a dialogue now. If you have questions or comments, we can go from there. So thanks very much.
Let me just step in. Thank you, Gurvinder, for very interesting and very important presentation, and found every key finding that you present today very much important. I see that there are people here with us in the room. I believe they are working with the GBV issues and the migrants, or they're interested in these issues. So please share your experience, give some comments or questions if you have any. During your presentation, there was a question about if there will be possibility to use your presentation to share it among the participants. So I believe it is okay. Of course, I will upload it to the Child Hub. I also shared here a whole study, Alone and Unsafe, that we uploaded also on the Child Hub. You can find the link in the chat here. So if you have any kind of questions and comment, please use the chat here to ask questions and give some kind of feedback. Yes. Nedad, if you want to come in also, please do if you have any kind of feedback.
And I might jump in with just one last point before the questions, is to say one really positive thing I think coming out of this is the opportunity for innovative work to reach kids better. one example where TDH and the Red Cross have worked together, and a group of other humanitarian agencies, about 15 humanitarian agencies have worked together, is the development of a massive open online course on working with children moving alone. And this is available for free in French, Spanish, Arabic, and English. We've just started the third run of the course. It's a 6-week course for frontline workers. It's on, I can send the link if you don't have it. It's hosted by Celsus University in Scotland.
Wow, okay, we have it. Okay.
Great, and it's a 6-week course. It was developed by Celsus University and Harvard University. They wrote the course, but supported by 15 of us, TDH included. Yeah. Developed it, so that's available. There'll be another run later this year, maybe 2 more. Also, in terms of innovative practice, I mean, some of the things that some agencies I know also we're looking at is things like reaching kids with simple comic books to show them safe ways to migrate. So we don't say you should migrate or you shouldn't. That's, of course, their own decision and their families. But for children that are migrating, what are some, a checklist with safety things, where to go for local help, these kind of things. We've seen other agencies like Plan International do some really great work around supporting insurance schemes for kids so they can access health services. I think there's more work we can do with technology, using machine learning, for example, with communities to identify kids who are at risk of becoming unaccompanied and provide them services. Maybe there's some other innovations, but, I think we need to step out of what we're comfortable with a little bit, find newer ways to reach these kids. So I'll stop there. Yeah,
great, fantastic. Thank you. And thank you for sharing this information about the e-course. As I believe we have and share it also on the Child Hub platform, we will also include it in the webinar page. When we upload the recording of this webinar, we will share the information about the e-course so the participants will be able to use it, of course, for free, which is great.
In fact, Gurvinder, I had enrolled and completed it in the first round last year, and I really enjoyed the course. So I would encourage all of the participants to also enroll into. It was a very nice learning experience.
Fantastic. Okay, I don't see any questions in the chat box. I believe. Okay, my question is so somebody's writing for now, and I was just also wanted to ask Gurvinder if you can share your email or something like that in the chat, maybe for the participants if they have any kind of questions after the session. But...
Of course, and I'm a little bit embarrassed to say I couldn't find the chat. Now I do.
Did you find
there it is.
Okay.
Here it is. I'll type my email.
Yeah.
And we're looking at doing a summary version of this report and relaunching it in Geneva, probably in May, but with more focus on innovative practice. And I think, Ninad, that maybe I'll reach out to you again later about that, because I think there's opportunities for us all of us agencies to jointly be promoting more innovative work and doing things together.
Yes, definitely. Much powerful. Yes, there is a question from Hale. Okay, what do you think about SGBV in the refugee camps and the host state's responsibility to ensure safety of children in the refugee camps?
Hale, thank you for the question. No, I think we would all completely agree that governments are responsible for meeting the rights of children, including migrant children, including children that come as refugees and are in their territory. Of course, the challenge we see in Europe and places where this project Bridge is working, in other parts of the world, is at times the government's capacity to meet that need is not adequate, or they're overwhelmed, or that children have particular needs where humanitarian agencies can assist. So we know that children have the right, including refugees, children who are refugees have the right to all their basic rights under the Convention on the Rights of the Child. But if the government is unable or unwilling to meet those, then of course humanitarian agencies, we need to support them or do the work in some kind of coordination with the government.
Okay, thank you. We have one comment. Okay, Hela says thank you. From Yeri, he or she, I'm so sorry, I don't know if he or she, I particularly agree with the point that humanitarian agencies need to work better across borders. Would love to know know more about how this will be developed with the Red Cross and the Red Center Societies. She, sorry.
Great. No problem. For the Red Cross and Red Crescent societies,
yeah.
I mean, I think probably like many agencies that work in different locations, it's something that we're always evolving. For example, in Europe, though, I think this is an area that we've been stronger in the sense we have networks because the Red Cross, most countries around the world, 192, have a Red Cross or Red Crescent Society. We're able to have regional conversations. And so in Europe, we have a network dedicated specifically to trafficking issues, another to protection, gender inclusion issues. And together, when we're having that, we're able to coordinate a little bit better. And I think of something like our work on restoring family links. So when children are separated from their families, trying to reunite them, trace them back to their families, make those connections back. We're often working across our Red Cross societies. So for example, in a place like Serbia, they might be in discussion with a place like Germany or the United Kingdom or Sweden in terms of connecting one family member to another, all of those kind of things. So it's something we do regularly for some work. In other ways, I think in terms of supporting children to access services across when they move to the next country, we're testing out these humanitarian service points, but again, it's work we could probably be constantly improving.
Thank you, Gurvinder. Yeri, hope this is okay answer for you. So if there is no more questions and comments, I would just like to add that if you want to we have a second question. Thank you, Hala. My second question is that you stated the number of unaccompanied children in Europe decreased recently. Do you think this is the real picture as a result of the child protection policies of the state's NGOs, or it is related to Turkey-EU agreement?
I think that's a great question. And I'm probably not expert enough in any way to answer that. I think the trends we see is that there have been these different systems put up by the governments to really restrict access for migrants in general, including children. So it's much more difficult environment now since 2015, that surge then. So I think you're probably pointing and you clearly work in the region as you're pointing in the right direction, where there's been a number of shifts happening, restrictions and barriers being put up around making it more difficult for children to access. I might leave that one there because I'm, again, not expert in that part of Europe for sure, but to say that it's clearly multiple things are happening to stop the flow of children. And we know they are continuing to come in smaller numbers, still putting their lives at risk. I mean, we're still seeing children passing away in the sea. We're still seeing children, die as they cross deserts, as they cross seas, as they cross mountain ranges. Children and families continue to invest a lot of their savings with smugglers to move kids. So we know when barriers are put up, it can become even riskier for children and even more hardship for children who are trying to move.
Yeah. And we have a comment from Yeri also. Thanks, definitely interested to learn more about the humanitarian service points and how these develop. This is for the question before the feedback. Yes. Okay. There's a lot of. Thank you.
Great.
Yeah. Okay. Fantastic.
Yeah, we'd be glad to share more. I mean, I think it's not that different from the idea from like UN agencies of their blue dots approach, trying to have services. I think it's a similar type of idea, the humanitarian service points, but making them really accessible and including in places that are not easily accessible, like in hard to reach locations, also having these type of services.
Yeah. Okay. So, okay, I'm tracking the chat to see if anything is happening more. Maybe there will be in a minute any questions, but while we wait a bit, I will just like to make a short note. You have something, Nenad, maybe?
No, please go ahead.
Yeah, just a quick note that if you want to receive a certification of attending this webinar, you can write to email. I will write it in the chat box. You can just send an email that you want to receive a certification of being in this webinar, and we will send it to your email. And also I will share a short evaluation now, just a second. So please give us a feedback so we can, like always, upgrade our services to you. Yes, I hope that you can see it on your screen now. Yes, I can see that you are seeing it. Thank you for your feedback. So I see there are no more questions and comments. Gurvinder nicely wrote an email for you there. If you will have any kind of questions, I believe it's okay that you send an email to our presenter today. Gurvinder, thank you very much again for being with us here. The webinar was really interesting, and I see that people had a lot of comments and questions. So the feedback is great. I see the feedback now also through evaluation is really great. Yeah.
Well, thank you for having me again. Thanks to TDH, especially just for the, I think, incredible work that you do around the world, including in Europe. And I hope that we can have more connections as we go forward. But thanks for this opportunity, and good luck with the work you're doing in the Bridge project.
Thank you very much, Gurvinder, for your availability and for the kind words. Yeah. It was a pleasure.
Thank you.
Thank you very much for being all with us today. And like I said in the beginning, the recording will be uploaded to the webinar page on all of these links. And please, you can see all of the information about the webinars and the news in the newsletter of the Bridge project, and also about from the Child Hub. Have a nice rest of the day. Bye.
Thank you. Bye.
Bye.